A few years ago, after school, I was hanging out with some friends. We were all laughing and having a good time until suddenly I fell to the ground as intense pain flooded my left knee. I quickly asked a nearby friend to pass me my phone so I could call my mom. The second she heard the tone in my voice, the fear and the pain, she rushed over to the school to drive me to the nearest hospital. Upon arrival, it seemed as though I was asked a million questions by a million different people. What's your name? How old are you? How tall are you? Has this ever happened before? And how did this happen? After being questioned, I was then scanned, poked, and prodded until finally I was placed into a room that I would wait in for a few hours. I happily watched episodes of Bones on my phone as my mom sat quietly beside me. Finally, the doctor came into the room and informed us on what had happened. I had a subluxation of my left patella, he said. Or, in simpler terms, I dislocated my knee. He then proceeded to pull out a small plastic cup holding 2 pills and said that he would be prescribing me some Vicodin. My mom, a registered nurse, immediately opposed the idea, knowing that Vicodin is a highly addictive and intense painkiller, much too intense for my situation. The doctor persisted, saying that it was necessary for me to feel better. My mom then suggested that I just take some Advil and go home. The doctor then made my mom out to be a bad mom for denying me the medication that I needed. I ended up taking the Vicodin and going home feeling goofy and giggly, but when I think back to that day, I look back in horror. Why would a doctor prescribe unnecessary medication, especially if they know it's addictive? These painkillers are called opioids, and the illegal abuse of them has been on the rise. Because someone can legally acquire them, it takes a lot of the sneaking around, often associated with drug dealing, completely out of the picture. Also, doctors have no way of actually measuring how much pain a patient is in. You can see a broken bone on a scan, but you can't see back pain on a scan, so there's no way of telling how much pain the patient is in. The rise in opioid abuse is frightening and should be fought head-on. The origin of this abuse began in 3400 BC when the Sumerians began to grow a plant in Mesopotamia that they referred to as Hulgil. This translates to joy plant and is now known as heroin. Now known as opium. They began planting it everywhere in order to increase accessibility that everyone had to it. Now, opium has many known effects on the body, such as pain management, cough suppressant, sleep aid, and even anti-diarrhea. It made its way through the silk trade up until it reached China. There it became so sought after that it caused the 2 opium wars of the 19th century. Now, drugs were modified from a time when opium was the most intense painkiller you could have to when it was being adjusted to fit specific needs. This led to the introduction of the wonder drug in 1893. It was sold in America then as a cough suppressant, but we now know this to be heroin. Morphine was also given to soldiers in order to help their pain, which we also realized was highly addictive. The more a person uses one of these forms of drugs, the more they need to reach a high. This is why longtime users often take very high doses in order to reach their high, and often overdose. The pharmaceutical industry has been shown to play a huge influence on the doctor and their prescription patterns. In fact, until the 1990s, doctors were hesitant to prescribe these opioids until the pharmaceutical industry reassured doctors that their medications were certainly non-addictive. The doctors then began to prescribe these medications liberally, treating it like a quick fix. And as of 2015, 33,000 people have died due to opioid overdose, and an estimated 2 million people suffer addiction every year. The pharmaceutical industry has also been shown to bribe doctors into buying their product. They offer pens, hats, free lunches, and even free travel opportunities, all in order to sell their product. It has also been proven that if a doctor denies their bribes, that the pharmacy will withhold quality product, only offering cheaper materials. This not only harms the doctor's reputation, but also the patient's well-being. The pharmacies have become so ensnared in their money that they have become desensitized to the suffering going on around them. Patients also have been shown to pressure their doctors. When you go to the doctor's office, you don't walk into the office, pay for the appointment, only to be told to go home and rest. You go with the expectation of receiving a medication that will make you feel better in just 30 minutes. By saying that a doctor is refusing to treat them, a patient can manipulate the doctor into giving them their medicine. When going to medical school, doctors are taught how to treat a patient, not how to say no to them. So when crossed with this tricky situation, a lot of times they don't know what to do. A terrifying phenomenon has been on the rise. It's referred to as skittling. This happens when someone goes to get a wisdom tooth removed or has a broken bone. They're usually given a 30-day prescription for some form of painkiller and take a couple and decide they're feeling all right, and they put it back in the medicine cabinet. What they don't realize is that this gives the entire household access to these medications. Skittling happens when, usually teenagers, go through the medicine cabinet and take a little bit of everything. They then go to a party and dump the pills in a bowl at the door, like a bowl of Skittles. This leads to very dangerous drug cocktails and puts a lot of teenage lives at risk. Society has seen the horrors that opioids can bring. Celebrities like Heath Ledger, River Phoenix, Elvis Presley, Prince, and Tom Petty all leave society mourning the loss of those who are gone too soon for its liking. And even though we know that fame and drug abuse often go hand in hand, we still see some of our favorite singers and actors almost worshiping these drugs in their interviews and songs. This also influences the populace as we listen to their songs and we watch these interviews and are subconsciously hearing these things. Pablo Escobar was a famous drug lord who lived in Colombia and moved massive amounts of cocaine to America. He was constantly being chased down by police until he was fatally shot when he was 44 years old. And he receives plenty of attention through movies and TV shows such as Narcos, Countdown to Death, and Blow, to name a few. My question is, what's the difference between this drug dealer and the one from whom many of us have purchased from? Today I will be discussing the natural ways in which this crisis should be fought with. If the human body is incredible enough to heal itself, why not allow it to do so? Of course, with a little bit of outside help. I will first be mentioning a doctor's solution, and then discuss my own opinions and finish off with a quick summary. I was curious to learn a doctor's point of view on this, so I interviewed Dr. Frederick Landro, a doctor of preventative disease and family medicine. He's currently practicing on Pearl Harbor Base and Kaneohe Marine Corps Base, but also practiced in Washington State and Texas. He has 20 years of experience and therefore has seen many cases of opioid abuse and overdose. I interviewed him on December 23, 2017 at his home in Bremerton, Washington. When I asked him what his solution to the opioid epidemic was in America, he responded quickly, saying that it was a simple solution. Insurance policies simply needed to stop covering the cost of medications. That way, only the people who actually needed it would be willing to pay for it. While this would work by limiting the access people have to these drugs, it also doesn't provide another solution to pain. People who can't afford it are just left high and dry with no solution. My own personal solution to the opioid crisis is through massage and physical therapies. My understanding of massage therapy includes, but is not limited to, sports massage, deep tissue massage, the Swedish massage, chiropractics, and fire cupping. One of the types of massage that I mentioned was the Swedish massage. In my opinion, out of the three, this is the most mild. It is used to increase blood flow to an area to relieve tension in muscles. It is commonly practiced using long and pressurized strokes with some form of oil to reduce friction. The sports massage goes up a level in intensity. This is used to treat injuries that are there. They use more pressurized strokes in order to improve balance and improve range of motion and help the injury to heal. Finally, the deep tissue massage are, in my opinion, the most intense of the three. This uses very pressurized strokes on the muscle and the connective tissue in order to allow the therapist to better heal it. Something that massage can heal is the soreness that you feel after exercising. I'm sure all of you have experienced it, whether it's after a run, after going to the gym, or a hike, or if you're like me, after going up the stairs a couple of times. What happens when you feel this pain is that there's a protein called cytokine released in the body. This increases the swelling. Now, a lot of people, including myself, usually take Advil to curb this or to rid this pain. But this is just putting a Band-Aid on the problem without actually addressing it. Massage has been proven to reduce the amount of cytokine in the body, therefore reducing and healing the injury better. And finally, chiropractic adjustment is another form of massage therapy that can be used to help heal the body. It is commonly used to treat lower back pain and uses intense thrusts and jolts in order to realign the spine. Just on Thursday, I woke up unable to turn my head past here. I couldn't drive, I couldn't work well. I was just suffering pretty much. But I did probably 4 or 3 appointments with the neighborhood chiropractor, and now I have enough range of motion in my neck in order to turn it all the way over my shoulder so that I can drive again and work, something that Advil wouldn't have been able to do. Now, Chinese fire cupping is an ancient practice. It happens when you take a glass cup and a piece of cotton dipped in some sort of lighter fluid. The cotton is ignited and it is placed in the cup, combusting the oxygen out. It is then placed on the skin and creates a vacuum seal. The skin is sucked inside and the blood is drawn to the surface, creating dark spots. Now, when I have gotten fire cupped, I found that the day of, it leaves me kind of sleepy, but the next morning I wake up with lots of energy and feeling looser and more energized. Also, it leaves some cool spots on your back that you can show off when you go to Ross. Finally, there are physical therapists who help patients not only heal their injury, but learn how to prevent the injury's reoccurrence through building of muscle around the injury itself. I personally, again, after dislocating my knee, attended multiple sessions of physical therapy. And through this, I was able to learn how to build up the muscle around my knee to help prevent the slipping again. I also decided to read some of Dr. Anna Lembeck's book titled Drug Dealer MD, How Doctors Were Duped, Patients Were Hooked, and Why It's So Hard to Stop. She is the Associate Professor of Psychiatry and Behavioral Sciences at Stanford University Medical Center. In her book, she mentions the drug monitoring program, a program that all doctors have access to in order to view their patients' prescriptions. She recalls a story when she was looking at the monitoring program and discovered that one of her patients was receiving 10 milligrams of Ambien from 10 different doctors. He had an addiction. The point of the story isn't only to show that doctors could prevent addictions through using the monitoring program more often, but also to show that patients are willing to go through extreme extents to receive the medication that they are after. She also mentions how Big Pharma and Joint Commission teamed up together. Joint Commission is the group of people that accredit hospitals and therefore have a lot of influence over them and their actions. They both agreed that they should be treating patients aggressively and with intense medications that they knew would work. So they teamed up together to peer pressure doctors into prescribing medications that they knew were too intense for situations. So this is why when I hurt my knee, I was given Vicodin instead of Advil. The vlog. Of course, there are always going to be patients who will need some form of painkiller in order to help them out. Patients who are coming post-op surgery, open heart, lung surgery, anything of the sort, pretty much any surgery. They'll need some form of pain medication to help relieve what they're experiencing. My solution to this is to give them a small dose of opioids, only enough to last about 7 days. That way they don't have a bunch of extra laying around waiting to be taken. If an addiction forms, they can then be weaned off of it using some other form of medication. There's Subutex, which is a non-addictive painkiller, and there's even medical marijuana. So when a patient comes into the doctor's office complaining of pain, the first thing the doctor should do is prescribe them one of these forms of massage therapy. After attending multiple sessions and perhaps trying multiple variations, they then can return to their doctor if they're still experiencing pain. The doctor then can prescribe them small doses of opioids, only enough to last about a week or so. After that, they can be weaned off of the medication when they feel relief and don't need it anymore. Our President Donald Trump has mentioned the opioid crisis multiple times in his speeches. However, he has given no proposal, and the statistics still remain the same. With my proposal, we will see a decrease in opioid addiction, not only because the amount of opioids distributed would be limited, but also because I would be proposing another solution to the pain instead of just saying only those that can afford it can take it. By breaking the doctor's habits of constantly giving out medications and the patient's habits of expecting to feel better in 30 minutes, our generation can be the one that ends this opioid crisis. We need to practice using natural remedies in order to help our bodies heal themselves. Doctors need to practice prescribing meditation rather than medication. Thank you.